Hello and welcome. And today I'm very pleased to introduce and invite back Dr. Rosalind Simpson. Now, Ros, we spoke about, I think it was about a year ago, not this time last year, about recruitment for a trial that Ros is running. And what we're going to do is have an update on that trial. And I think what's really interesting is for us to sort of talk also about this is trials in real life. They don't happen overnight. And one of those things is because of the difficulty in finding people and getting people to go on trials as well, which is why quite often they're a long time as well for the recruitment. So welcome again, Ros. And I'm very pleased that we're going to be talking about lichen sclerosus.
Yes, thank you very much. And we're picking up again on the trial called the PEARLS trial, which we discussed last year. And PEARLS stands for Proactive Against Reactive Treatment for Lichen Sclerosus. And we're looking at how best to manage and treat the condition longer term for people.
Do we
Um,
just quickly recap again? Sorry, I was just going to say, should we
no
quickly
problem.
recap what the condition is? Because I know that one of the things is, I know it's not termed necessarily as a rare disease. I mean, it's not common, but it's not uncommon. And I think a lot of that is some people don't know what it is that they might have.
You're right. So sclerosis is LS for short, is something that can affect the genital skin and it causes itching, discomfort, fissuring, sort of painful paper cut type areas. But it's more than just an itchy skin condition because it can cause longer term effects such as changes to the anatomy and scarring of the skin in the vulval area. And there is also a small risk of cancer development, particularly in untreated LS. So it's a condition that affects the genital skin. It has day-to-day impact on quality of life and function, but also these longer term worrying effects as well. And
And
it does impact about 1 in 100 women, we think, but we don't have really good idea of numbers of people that are affected overall. So not really as rare as what might originally be considered.
because last year we had Claire who came over and who's a great advocate for the condition because she does have it and has had it to the I don't know if one would call it to the extreme, but it's quite frightening hearing some of her experiences. And I think that was because she wasn't diagnosed for ages and a lot of the issues. So we'll post that as well because I think it's really important to hear from people that have the condition to understand as well. Um, so Ros, moving on to the trial, do you want to quickly just say what you're looking for and what it if one wanted to go on it?
For sure. So LS, when recognised, is quite easily treated with a topical steroid ointment or cream. And about 7 in 10 people will get good control of their LS with a 3 month course of treatment. But after that 3 month course of treatment has worked and the symptoms have improved and they've gone into what we might consider remission, we then don't know what's the best way to treat the LS longer term because it's not just a case of getting it into remission and then treatment is done. It's a long-term condition. There's not a cure as such, so it's about controlling it longer term. You might use eczema as a potentially similar condition, although eczema affects the rest of the skin. It's a long-term inflammatory condition which comes and goes over the course of a lifetime. This is the same with LS. It might improve, but then it might worsen and get flares over a period of time. So we're really looking to see whether patients using steroid ointment regularly, say twice a week, keeps it under better control than just using it as and when they get flares of their symptoms. So we're looking to see whether using the topical steroid preventatively in a proactive way is more beneficial longer term. So what we're looking for is females with lichen sclerosus affecting their vulval area, and this includes children as well as adults. We're looking for people who have well-controlled vulval LS to enter the trial. And they would come onto the trial for a 2 year period and they would be allocated to use their steroid ointment either two times a week for that 2 year period, or as required for flares of their symptoms.
And you mentioned age, and that so clearly it happens to children as well. And is there an upper limit as well that you're looking for, or actually, to carry on having the symptoms?
There's no upper limit in the trial. I mean, it would be based upon whether someone feels like they could come to appointments and be part of something that requires visits to hospital intermittently for a 2 year period. In terms of the lower age limit, we're accepting girls of 5 years of
Wow.
age and older.
And is this, so you have to obviously see somebody, and is this at Nottingham, or can you go anywhere?
We have multiple sites involved in this trial. So we're looking for 400 participants in total. That's more than what Nottingham alone can manage. We currently have up to 19 sites involved, and we may well have more in the future. So some of our sites are taking what we call self-referrals and referrals from GP surgeries. So the sites that are particularly taking patients who express interest who aren't already under their care are Aberdeen, Barts Health in London, Gateshead, Leicester, Nottingham, Liverpool Women's Hospital, and Liverpool Access.
But you said also, though, that your doctor, if you tell your doctor about it, they can then self-refer you onto a site, possibly.
Yes, so we have GP surgeries who are involved with some of these sites as well, who would be able to identify and refer patients through
Yeah.
to. Yes.
And I think also with research, I mean, know that from our experience that quite often people are really quite happy to travel if they think there's something, because when you have something like this, I mean, it really does affect your day-to-day life, and people are prepared to
Mhm.
go to travel to find out how they can manage it. I don't want to use the word cure, but absolutely manage it far better than maybe they have done so far. And I think one of the things that you mentioned is also the diversity, which is always a, a problem with a lot of trials. I mean, first of all, I mean, generally talking about trials, diversity is, we all know, and it's far more in the news now that, oh my God, everything's tested on a male before they then put it to a female. But
Mm.
here, obviously, we don't have the issue. But what we have is that we're looking for all sectors of the community, aren't we? Not just the people that generally come forward.
That's absolutely right. LS can affect women of any skin colour, any background and ethnicity. And what's really important in trials is that we are able to collect data that is representative of the population of people that might be affected by a condition. And so at the moment in Pearls, 96% of our participants are from a white ethnicity, and we would really love to have people from different sectors to come forward, as you say. So we have been running campaigns to try and publicise the study to different groups where people might feel like it's okay for them to come forward and to express interest in the trial. But we do find that there are often cultural differences, and having a condition in the genital area is still a real taboo subject for some sectors of the community.
Mm. I mean, I think in it, and it's hard enough if English is your first language to go and express yourself to a doctor, let alone if it's not your first language. I think there's lots of barriers like that as well that present.
Yes, absolutely. There's so many different social factors, but what we really want to make it clear is that LS can affect anybody. And if there is itching and symptoms in the vulval area that isn't going away, regardless of what background you are from, it's important to get it checked out and not to be ashamed and embarrassed,
Mm.
such that you don't go to your GP, because it's
Mm.
really important to be assessed and examined in the first instance.
And on a very positive note, since we last spoke, I think a new website has been launched by University of Bristol, and I've had a look of it, and it's just so easy to understand and simple, and it's all about, which is what Talkhouse is all about, is education. If you'd like to explain a little bit about the website, Ros.
Absolutely. So the new website has been led by Dr. Sophie Rees, who's a researcher at the University of Bristol. And it's been a real collaborative effort with researchers, health professionals, and patients. And it's been funded through the Wellbeing of Women, British Society for Vulval Disease, and the British Association of Dermatologists. And as a collaboration, we have developed this website, which is really aimed at being a resource to empower patients to know more about LS and, in particular, how to manage their condition and to arm them with information that they can also take to their health professionals. There's some downloadable content, symptoms and signs checklist, which is great that if someone has symptoms in the vulval area, they can go through this checklist and tick items off and take it to a health professional to say, do you think I could have lichen sclerosis? I think it will help really focus the mind during the consultation, and it's got a treatment plan as well that can be downloaded and completed and therefore individualized for an individual patient so they know how to use their treatments. So it's been brilliantly received actually. It's had more views than we could ever have imagined, and it's had over 1,000 downloads for the downloadable content now. So people are using it, and I think it's a real game changer in this space.
Mm. Excellent. Well, we'll certainly put all the links to it as well. So on that note, we're still recruiting. Talk Health is still supporting. I don't know if there's anything else that you'd like to add at this stage, Ros.
I think there is a movement, momentum's being gained in this area, and lichen sclerosis is being talked about more now than ever before. And in fact, since we've last spoke, this year alone, there's been two radio programs that have specifically spoken about LS on the BBC. So there was a show on BBC Radio 5 in February called The Time of the Month, hosted by Naga Munchetti, where Claire Baumhauer, the patient representative, patient advocate who you mentioned, was speaking on as well. And there's also been an Inside Health episode in April where LS was mentioned as well. So I'm really pleased that it is a topic that's being talked about more and awareness is being raised. But I would really like to encourage people, if they think they have symptoms in the vulval area and they're not improving, I really want to encourage people to seek an appointment with their GP, with their primary care health provider, and make sure it's a face-to-face appointment, because we're in a world of online consultations now, aren't we? Where there can be telephone calls and online consults, but for something like this, having a face-to-face appointment whereby an examination can take place is really important.
Yeah, absolutely. Well, I'm very glad to hear that the recruitment is going well, and we wish you well for the next stage of the recruitment. And if you are interested, please look at all the links, look at all the information, and also we'll put a direct link to the trial as well. Thank you very much, Roz.
Thank you. Bye.
Bye.